Hi everyone, thanks for tuning in. I'm Dr. Harmony Layton Cipher. I'm a cardiologist with the Pascack Valley Medical Group, and I'm here to answer your questions about heart disease and its risk factors.
What are the most common cardiovascular diseases?
So the first question is, what are the most common cardiovascular diseases? When you talk about heart disease, there's many different diseases of the heart. When we talk about coronary artery disease, that's diseases of the blood vessels of the heart. When you think of a heart attack or chest pain, we're referring to that. Heart failure is another common heart condition where the heart pump does not work and or does not relax normally. Um, Additionally, you can have certain arrhythmias. Hypertension, we also would consider a disease that can affect the heart. So there's a very broad category of different types of heart diseases depending on the function. Also, you could think about valvular heart disease as well, with the different valves and how they function with the heart.
What are the warning signs or symptoms of cardiovascular disease?
What are the warning signs and symptoms of cardiovascular disease? So typically when everybody thinks about heart disease, they think about chest pain. Chest pain is not the only symptom you can have when referring to heart disease. It is definitely a main symptom that would be of concern. A lot of times people report fatigue. You know, they used to be able to run a mile, now they're running half a mile, they're getting short of breath or tired. Basically, a decrease in exercise tolerance is also concerning. Sometimes people can present atypically too. They can have arm discomfort or jaw pain. So not everybody goes by the book, but any type of symptom that you have where you feel like your exertional tolerance might be less would definitely be an alarming symptom to us that would signify that there may be some underlying heart disease.
Do these signs and symptoms appear differently in men in comparison to women?
So the next question was, do these signs and symptoms appear differently in men versus women? So I just want to answer that and then start off by saying that heart disease is actually the leading killer in women, which many people don't realize, and a lot of women kind of underestimate the significance of heart disease and don't get checked. So that's very important. But in terms of presentation, yes, sometimes they do present differently. Women typically present a little bit more atypically, where men usually have the signs of the heart, chest pain, pressure in the chest. Women can oftentimes present atypically with abdominal discomfort, jaw pain. Sometimes they actually have even no pain. They might just have, an episode of lightheadedness, extreme nausea, vomiting, sweating. So they do present atypically. Sometimes it can be back pain as well. So any kind of symptom that you have that you find is concerning, I would just advise you to get checked, because not all the time does anybody present by the book definition of heart disease, with that gripping chest pain that's just kind of in the center. It does not always have to be that way. So if you feel something, definitely get checked.
What causes cardiovascular disease?
The next question is, what causes cardiovascular disease? So there's many different causes of cardiovascular disease, and that would kind of go into, I guess, answering any questions about risk factors too. So when you're talking about coronary heart disease, typically that's a buildup of plaque in the blood vessels of the heart. Risk factors for that would include diabetes, high blood pressure, smoking, family history, obesity, high cholesterol, all the things that we think of that, when you're contributing to heart disease, those would be the major factors that would contribute to that.
How is cardiovascular disease treated?
The next question is, how is cardiovascular disease treated? So if you're talking about cardiovascular disease in terms of a blockage in the blood vessels of the heart, typically it really depends on how the person's presenting. If they're presenting acutely with a heart attack, then usually what ends up happening is they undergo what's called a cardiac catheterization, where they go in with needles and wires into the blood vessels of the heart. They look for a blockage, and they would then fix it with a stent. Patients that are presenting kind of to the office with symptoms that were not really clear about what's going on typically will undergo a stress test to look for indications of a blockage. And if there are suggestions of a blockage, they may then additionally undergo the cardiac catheterization as well. Also, we have medications that will treat signs and symptoms of cardiovascular disease, such as antiplatelet medications and other anginal relieving medications as well.
How does genetics affect cardiovascular disease?
The next question is, how do genetics affect cardiovascular disease? So genetics definitely have a role. Even where I trained, you would see certain ethnic populations, let's say, that present earlier, even in their 30s, with heart attacks. And a lot of that is genetic related. People that have a very strong family history of first-degree relatives that have premature coronary artery disease typically have a higher risk of developing coronary artery disease themselves. So yeah, it's a big impact from that.
What are the main risk factors?
So the question is, what are the main risk factors for heart disease? So I think we touched on that, but I'll reiterate it again. High blood pressure is a risk factor. Diabetes is a risk factor. Obesity, smoking, alcohol, high cholesterol. These are all big modifiable risk factors, and other is genetics, as we just touched on before. So you can't change your family history, but certainly you can work on modifying all those other risk factors, stopping smoking, getting your blood pressure under control, losing weight, watching your diet, getting your diabetes under control as well. Those are all very important ways to modify your risk factors for heart disease. Also, diet and exercise as well. The American Heart Association makes recommendations in terms of the amount of exercise and the type of exercise that you should do. They typically recommend 150 minutes a week, which I know sounds like a lot, of at least moderate intensity exercise. But to be honest with you, do whatever you can, at least get out there. Always listen to your body, and if it's telling you to stop, then stop. But, the more aerobic exercise you do, the better your outcomes should be. Also, in terms of diet, limiting your red meat, they actually recommend now more of a plant-based diet, which does not mean you have to be vegan or vegetarian. It's basically more replacing, your red meats with plant-based proteins, which have been shown also to reduce your incidence of coronary disease.
What is the direct link between smoking and heart disease?
The next question is, what is the direct link between smoking and heart disease? Smoking, I think, is linked to a lot of diseases. You name it, probably smoking is a risk factor for it. But certainly smoking is a very big risk factor for heart disease. I mean, even in my training and fellowship, I've seen a lot of younger patients, 30s, 40s, coming in with heart attacks where smoking was their only risk factor. So that's definitely one risk factor that is very modifiable and should be stopped to minimize your risk of heart disease, amongst other diseases.
What can I do to reduce our risk of developing heart disease? And what can I do to reduce my risk of developing heart disease?
So the next question is, what can I do to limit my risk of developing heart disease? So I think we just kind of touched on that, but I'll say it again. All the modifiable risk factors need to be modified, right? So you cannot change your family history. If you have a family history where mom, dad, and all three of your brothers have heart disease, that's not something you can change, but you can modify all the modifiable risk factors. If you have high blood pressure, make sure that's under control. Same with diabetes. If you're obese, make sure you're exercising, watching your diet, get your weight under control. Get your cholesterol checked, make sure that's under control. Everything possible that you can do to minimize your risk factors should be done. Make sure you're following with your doctors. If you have a family history, go ahead and go to your primary doctor and or a cardiologist and get checked. Same thing with any of the other risk factors I mentioned. Make sure you're following closely with your doctor, getting your blood work done, making sure your blood pressure is checked as well. And, together along with your physicians, you should be able to at least minimize your risk factors and stop smoking and alcohol.
What happens if heart disease is left untreated?
The question is, what happens if heart disease is left untreated? So there's no real direct answer to that. It really depends on the severity of your heart disease. As we get older, starting in our 20s even, we have small amounts of plaque that develop in our blood vessels. However, if you have significant blockages in your heart, if left untreated, can lead to a heart attack and or, unfortunately death. But it's a very variable situation, right? So it really depends on what the severity of disease is. And typically, if your disease is severe, you will have some signs or symptoms that are warning you. So I don't think we have any other questions. Thank you guys so much. It was my pleasure to answer all of your questions. Again, I'm Dr. Harmony Layton Cipher, and hope to see you guys soon.